Hello everyone, welcome to Alacrity Explains Anatomy. This is an introduction to anatomy part 2. We already did our part 1 video. If you have not watched the video, go and watch the video. The playlist for general anatomy, you'll find the part 1 video. So for the part 2, we are going to look at body planes, and planes are imaginary flat surfaces that are passing through the body. They are imaginary. The imaginary plane surfaces or flat surfaces that are passing through the body. We have the median or the mid-sagittal plane. It is a vertical plane. Don't forget that. It's a vertical plane that divides the body into equal right and left halves. We have the sagittal plane, which is also a vertical plane that is parallel to the median plane, and it divides the body into unequal right and left halves. We have the coronal or frontal plane, which is also a vertical plane that divides the body into an anterior part and a posterior part. We have a transverse plane, which is also regarded as the horizontal or axial plane. It divides the body into a superior part and an inferior part. Now, if you look at this image, you see the planes in anatomy. You have the median or the mid-sagittal plane, and you have the sagittal plane. Now, a lot of students mistake the sagittal plane and the mid-sagittal plane. The mid-sagittal plane, like I said, divides the body into right and left equal halves. The halves are equal. While in sagittal plane, it divides the body into unequal halves. See that it's not directly in the midline. It divides the body into unequal right and left halves. While for the coronal plane, like we said, divides the body into anterior and posterior. You have an anterior part and a posterior part. That is the function of the coronal plane. You have a transverse plane that divides the body into a superior part and an inferior part. Now there's an oblique plane which passes at an angle to standard planes. Now it's not in this image, but you have something like this. It's diagonally placed, oblique, passes through standard planes. Now, what are the body axes? Body axes are important because movements occur around the body axis. So we have majorly 3 body axes. We have the vertical axis, which runs from superior to inferior. This is your vertical axis. It's also called the longitudinal axis. Passes from superior to inferior. We have a transverse axis that runs from side to side, from right to left and left to right. We have a sagittal axis that runs from anterior to posterior. This is your sagittal axis, runs from anterior to posterior, while the transverse axis runs from side to side. Now let's look at anatomical terms of movement. We have flexion, which is a decrease in the angle between 2 parts. Decrease in the angle between 2 parts. Now, when you look at flexion at the elbow, you see that there is a decrease in angle between the humerus as well as the bones of the forearm. While for extension, it is an increase in the angle. Increase in the angle between 2 parts. Now, if you look at this image, this is flexion. You are decreasing this angle, while extension, you are increasing the angle. This is same thing. You have flexion here, you have extension here. You are increasing the angle, extension. You are decreasing the angle, flexion. This is flexion and this is extension. So when you move the leg towards the thigh posteriorly, you have flexion. When you straighten the legs, you have extension. So we also have hyperextension. This is when you extend beyond the anatomical position. For example, looking upwards at the neck. When you try to look at the ceiling, when you look, this is a hyperextension. We have abduction and adduction. Now, abduction is movement away from the midline or the median plane. You're moving away from the median plane, like you're raising your arm away from the median plane. This is abduction. You're moving away from the median plane. While adduction is moving towards the median. You are adding. You're bringing your arms backward, bringing your arm back to the side, back to the median plane to be in an anatomical position. We have medial rotation and lateral rotation. Now, medial rotation is also called the external rotation, while lateral rotation, the lateral rotation is also called the lateral rotation, external rotation, medial rotation, internal rotation. So for medial or internal rotation, the anterior surface moves towards the midline, like you're turning the humerus inwards, something like this. Let's look at which image here gives us this. You're moving the hand more to the medial direction. Let's assume you're taking your arm to move medially. This is the median plane. Look at this image. If you look at this image, you see that let's assume you're taking your palms, the anterior aspect of your palm, to face posteriorly, while the posterior aspect face anteriorly. That is the medial rotation. Why? If you do the opposite side, you have a lateral or external rotation. The anterior surface turns away from the midline. We also have circumduction, which is a circular movement. It's a combination of flexion, extension, abduction, adduction, so that it is seen in the shoulder and hip joints. It's a movement that is common at joints that are very movable or highly movable, like the hip joint and the shoulder joint. So this is your circumduction. Moves in a circular fashion. It's a combination of flexion, extension, abduction, and adduction. We have pronation, which is movement of the forearm. The forearm rotates so that the palm faces posteriorly, while for supination, the palm faces anteriorly or superiorly. You have your pronation, where the palm faces this way, and you have your supination. Imagine supination, holding a plate of soup. Your palms are facing superiorly or anteriorly, while for pronation, you are trying to pour the soup. Your palms will face posteriorly or inferiorly. Good. So let's look at more movements, which we have we have inversion, where the sole of the foot turns medially. Look at this image. You have your inversion here. The sole of the foot is facing medially, while when the sole of the foot is facing laterally, you call that eversion. So inversion, sole of the foot faces medially. Eversion, the sole of the foot faces laterally. We have dorsiflexion and plantar flexion. Dorsiflexion, the foot moves upwards at the angle. Dorsiflexion. Plantar flexion, the foot points downwards. Look at this. Dorsiflexion. The dorsum of the foot is pointing upwards. The foot pointing downward is what? Plantar flexion. So that's dorsiflexion and plantar flexion. We also have opposition and reposition. Opposition, in this case, the thumb touches the fingertips, touches the other fingertips, while for reposition, the thumb returns back to its anatomical position, returns from opposition to its anatomical position. This is what we are talking about. This is opposition, where the tip of the thumb is touching the tip of the fingers, while reposition, the thumb goes back to its anatomical position. We have elevation, it's a movement. You move your shoulders upwards, you move upwards, shrugging of the shoulders, while depression is a downward movement where you bring the shoulders downwards. This is elevation and this is depression. Elevation, shrug the shoulders. Depression, you bring the shoulders downwards. So moving forward, we have protraction and retraction. Protraction is a movement where you move anteriorly. You protract the mandible or the scapula, while this is a protraction. While retraction, you are moving it backwards. So protraction is a movement anteriorly, while retraction, you move posteriorly. We also have lateral flexion, which is the side bending of the neck or the trunk. When you bend your neck to the side or your trunk, that is referred to as lateral flexion. So what's the importance of these anatomical terms? We need to know these anatomical terms because it helps to prevent ambiguity among health professionals. Because during conversations, having a conversation between maybe a doctor and a nurse, or a doctor and another health professional, or a nurse and another health professional, you have situations where a doctor is telling another patient that the patient has an injury on the right ipsilateral eye, or he has an injury on the medial aspect of the thigh. Because of these anatomical terms, the doctor is able to know where the injury is even without seeing the patient. So That's very important. It prevents ambiguity in communication. It guides surgeons during surgery so that they know where they are going to cut and fix. It is used in imaging in radiology. It's essential for describing fractures, wounds, and swellings. It's also important in physiotherapy as well as orthopedics. Very, very important. So thank you for watching. That's all for the part 2 of anatomical terminologies, introduction to anatomy. Don't forget to subscribe and turn on the notification button so that you get notified when I drop any video. Thank you.